Hi guys, so in this video I want to give you some super practical and easy tips for relieving sore throat and mouth, or also pain in your head and your sinuses, and finally how to get some sleep, because it's super important. So number one is hydration. I drink about 10 of these every day. You see, they're pretty big, and it's fine if you go to the washroom so often. Your body needs to get hydrated. So another thing is a sports drink. Don't abuse with the sugar, of course, or caffeine, but sport drinks are good, that they maintain the electrolytes balance in your body. Another helpful thing is my body, the humidifier. We just got it last week. By the way, this is day 5 post-op, and I feel so much better because this humidifier is just like, you don't feel it right away, but if you don't use one, you will, because when you're breathing through your mouth all the time, your mouth will end up feeling like you went to the Sahara Desert. And another thing that helped really is the Vaseline, because I was told maybe use some lip balm, but that gets absorbed really fast. So a Vaseline or any kind of petroleum jelly is more stays longer on your lips, and you can even drink, of course, reapply it as needed throughout the day before your lips get dry, to make sure that they stay well hydrated. Open the window because you need some fresh air. That is very important, otherwise you might get a headache. Another thing is like gel packs, or even a towel. You can wet it and stick it in the fridge, and that you can put on your forehead, on your eyes, even on the tip of your nose, but be careful, don't put any pressure on it. I was lucky that my intervention was not very difficult, because you might think, oh wow, after 5 days she looks like completely normal. It's because my septum was deviated just a little bit. It was mainly a turbinate reduction. Another thing important is get some of these, like these are the little dressings, and also some surgical tape from the pharmacy. And when you're putting it on your nose, when you're changing the dressings, one important thing is when you remove it, be careful when you're removing the tape, and don't remove any of the packing inside the nose. That is to be removed only by the doctor, because that is really important to stay in place. So when you're change just the exterior, like what they call the mustache dressing, and when you put it, make sure to put the tape up here, like tape it around your nose, because the doctor told me that if you tape it like here on the cheeks, your cheek skin might get really irritated, and then it's not going to be very pleasant. Another thing is change these whenever they get like wet with either blood or whatever is coming out of your nose, because it needs to be like dry in your nose, so your nose can dry as much as possible. Also, the doctor told me that if you stop bleeding, just remove it. It's fine, because it actually helped me a lot when I stopped wearing the bandage after like day 3 or 4. Then suddenly, like I started being able kind of to breathe through my nose, and I was like, wow, this is amazing. Like if I had kept that bandage, the wetness would have persisted, So another thing I have here is a little thermometer, because in case you feel like sometimes you might feel feverish, but actually when you measure your temperature, you might realize that you don't have a fever. So listen to your body, but also don't freak out. Your body might just react in various ways, but this is a good sign of infection. If you have a high fever or very big pain, that might be also something to look out for, so be careful. Another thing is, of course, painkillers. Don't overdo them, even though you might be tempted to take more than prescribed. If you do take more, then it will affect your liver, and it's really not good, so be careful with that. And in terms of sleeping now, just let's take a moment to talk about the recommendation about sleeping elevated, because you know they say, oh, you're supposed to put a bunch of pillows and build this kind of pyramid that's 45 degrees. I tried that the first night. It was horrible. I mean, for whoever can sleep like that, I do recommend it, because it actually reduces the swelling and helps with the circulation and everything. However, for me, I'm a person who can never sleep on my back. I always sleep on my side. So I asked the doctor on the second day when I had my follow-up, doctor, what can I do? Can I sleep on my side? And he said, sure. And I was like, oh my God, I just spent like a complete night in misery for nothing, because actually you can sleep on your side and sleep not as elevated as needed if you can. Of course, it depends on each person. Each person is individual. The downside, if you do sleep normally, it might give you a bit of a headache, because the stuff might, like, you know, accumulate in your sinuses and it won't be able to drain. But for me it helped, because at least I was able to get a few hours of sleep that was so important. Another thing is earplugs, because sometimes with so much noise and tiredness you might just need to tune out. I have my little buddy Huxie here, so maybe take like a pillow or something. Sometimes it helps to hug something. And something embarrassing, in case you know, from the anesthesia you might sometimes not be able to go to the washroom for a few days. Don't worry, there are all sorts of products in the pharmacy. Funny story, actually my husband ended up taking by mistake my laxative drink, and then 45 minutes later he was not very happy, let's say. So that's for those tips. And just some practical little last words is, number one, you are not alone. We're all in it together. There are a lot of people out there having this type of interventions. So just stay positive, think about the others, and check on the internet what's out there. You might find information and like experiences, but don't think that everything necessarily applies to you, because some people say, oh, the anesthetic didn't work or stuff like that. Those are super rare cases, so don't necessarily believe everything. Or maybe it is true, but it doesn't necessarily apply to you. So you are unique, love yourself, and just take care of yourself, let yourself rest, and don't be scared to ask your friends and family to help out a little. It's just for a few days, and I know that the first like 2 or 3 days might be quite hard, but don't worry, it will get better. And don't be scared to do this surgery. It's so much worth it. Like already within 5 days, I feel so much better. Oh my God, it's incredible. And I so don't regret doing this. It's just like something that is a life-changing thing. And please share your experiences, share your comments in below the video, and I hope that everything goes well with you. If you have any questions, don't hesitate to reach out to me. I'm gonna put my contact information in the description. Thanks!